I say, you reset my buttons, we're having a problem.
Hello, my name is Michelle Johnson, and this is my process speech on how to do an EKG. Have you ever heard of an electrocardiogram? It's a test that is performed when you present to the hospital with chest pain, or if you are at your primary care physician's office and you have a history of congenital heart failure. In my process of showing you how to do an EKG, it may be different than the one that you have had if you have had one before, due to the fact that many different facilities have many different machines, many different leads, and do their EKGs differently. The first thing I would like to talk about in my process is comfort. When your patient comes in to have their EKG done, if it's on a routine outpatient procedure, you want to make sure that the room is warm and that the patient is comfortable. Therefore, they will not shiver or they're not nervous. Make it homely. That way you prevent artifact, which we will come back to later. The next thing I would like to talk about is the machines themselves. The machine that I will be using for this process is the Philips PageWrite TC70, the one that we use at our facility. The lead that I will be using is the Kindle Q Trace 5400 resting EKG lead. The Philips is a three-step process. The first step being mapping out your patient for where the leads need to go. You have 10 different leads that go in 10 different places. You have one on each arm and then one on each leg. They are known as right arm, or RA, right leg, RL, left arm, LA, or left leg, LL. The next ones that you have go solely on the chest. You have these 1, 2, 3, 4, 5, and 6. V1 will be placed in between the 4th and 5th rib, or better known as the 4th and 5th intercostal space. V2 goes directly across from there on the other side of the sternum. V3 goes down. 4 typically goes underneath the nipple. 5 goes next to that, and 6 brings it back up. Therefore, you have a cup underneath the pectoral or the breast. If the patient has large breasts, then what you would want to do is raise the breast and place the leads right underneath the crease. That way they are in the proper spot and not placed too low on the stomach. The second step to the EKG process is putting in the demographic information. With the Philips, you place the visit number or the social security number, last name, first name, age, sex, race, your initials to show that you were the one who performed it, the ordering physician, the room number, and the area that the patient is in, for example, the emergency room. Once you have entered in this information, you will then go to the print button. When you hit the print button, you will see a page that presents a series of EKG lines looking like this. Now, back to artifact. If the patient is not comfortable, if they're nervous or cold, causing them to shiver or fidget, then you will have what we consider a yucky EKG line, which is the artifact. Artifact consists of lines that are really thick, like this. They can cross into each other, or they can have false waves. This is what you do not want, as it does not show a proper EKG. Once you have successfully gotten a smooth EKG line, you can then print the page. Once you print the page, you will then remove the leads from the patient, cover them back up or allow them to get redressed, and you will take your EKG and give it to the person who it properly needs to go to. In the emergency room, for example, we give them to our ordering physicians. Unless they have been admitted by a team such as medicine or trauma, and then it goes to the nurse for the nurse to present it to the doctor. After your EKG is given to the proper person, you have then successfully completed your EKG process. Thank you. My name is Michelle Johnson, and this is how to do an EKG.